This is Dr. Sajid Maqbool. People, especially parents and some child specialists, have asked me about my feelings about the opening of schools. I must say that this has been given careful consideration, and the decision to open schools is a proper one, I think. Now, of course, we all have to act very, very responsibly, and I'll begin with the administration of the school. So the administration of the school has to ensure that they have proper arrangements that facilitate physical distance between the students. They should also provide for proper hand washing with clean water and soap, and of course hand sanitizers, and the requirement of masks must be made compulsory, not only for students but also for teachers and also for workers that work in the schools, the working hands, whether it be in the admission office or in those responsible for cleaning or clerical work. The teachers have a greater responsibility because the students come there to learn, and of course this is a part of the learning process, and they will have to ensure also that the guidelines for minimizing the chances of transmission are carried out, and they have to also make sure that children are giving appropriate messages and given talks. They could do that themselves or have pre-recorded messages or have people come and talk to them for the benefit of the students. They'll also have to make sure that there is distancing when they are teaching. They have to be sure that they carry out the necessary standard operating procedures, wearing masks, washing hands, etc. They will also have to teach the students on how to report an illness. For example, if a child is not well, then they must be told that although cough is a common problem during the winter months, a dry cough along with fever and body aches, or a high fever especially, must be reported to the teacher so that she can talk to the parents. The parents, of course, have even more responsibility, perhaps the greatest, because the child has been spending a lot of time at home, and children will often copy what they do practice at home. So if there is good hand washing, good hand hygiene, there is the use of masks, and they have been told the importance of these measures, then and they will learn from the parents. So the parents have to set examples, and they have to make sure that they don't worry unnecessarily about children going to school. Now, on the one hand, some parents are opposed to sending children to school, while at the same time they will take them out to movie theaters or to weddings or to parties where there is a lot of mingling. Now, lastly, the students themselves, especially those who understand, will learn through this process the importance of keeping away from each other, keeping away from handshaking, hugging, mingling with other children, and also sharing, which children will often do with each other, of personal use items, and also to be able to report any symptoms that they may have. Now, if we all take precautions, and I believe the government will also be putting out some instructions regarding this, then we can have our children go to school, continue to learn, and continue to acquire knowledge. At the same time, this gives us an opportunity to learn about personal hygiene and health, and this will ensure better health not only for this particular virus but for many other diseases that our children confront. Now, I must say in the end that most children can go to school, but there will be some children who will have special problems for which only your doctor can determine whether it is safe or unsafe for this particular child to go to school. And when that happens, then an appropriate note will be sent to the school and to the teacher, and then the student can learn at home. I hope this helps you and helps your children. Good health and good learning.